Hi, my name is Destiny Stafford,
And I'm Shelby Chandler.
and our poster presentation will focus on improving service access for low socioeconomic status children with autism spectrum disorder.
To introduce this topic, it is imperative to mention a few statistics about the rise in poverty and prevalence rates of autism.
A recent census approximates that greater than 16% of the United States population and 20% of United States children live below the federal poverty level. These are the highest rates in 20 years. These economic factors tend to influence people's health generally.
Autism spectrum disorder prevalence rates have also increased since the beginning of the 2000s. In a study by Boat and Wu, the authors demonstrate that ASD rates rise as SES increases. This means that children with lower SES with autism may be adversely affected by disparate healthcare access.
This presentation will examine how SES relates to health disparities among children with ASD and how these disparities can be ameliorated.
We will also offer recommendations to improve access to interprofessional autism services and treatment options for low SES families.
According to Horland and colleagues, low SES families with a child with ASD face disparate obstacles to accessing recommended interprofessional services. These barriers arise when presumed prerequisites for care are not met.
These prerequisites for care may include reliable transportation, time for parents and guardians to dedicate to services, a stable environment for any at-home services, and the financial means to pay for treatment.
These factors are often assumed as given in families seeking treatment for ASD. However, low-income households often struggle to attain all needed prerequisites for effective care.
Studies show the best practices for effective interprofessional care involve early diagnosis and early intensive interventions for children with ASD, including speech, physical, and behavior therapies.
Clinicians can proactively address disparities by enhancing parent education to combat resource deprivation and improve setting factors to increase service delivery.
There are several steps that professionals can take to combat disparities faced by low SES families. The first is to identify at-risk families. Researchers screened families using a social determinants of health survey and recommended that low scores should receive more information on the quality of services available to them and the best way to access these services. This would be a first step in addressing resource deprivation among low SES families with children who have autism.
The second step to improve access among this population would be implementing family-centered approaches that address resource education, case management, and social support optimization among families. Targeting these areas of focus would address resource scarcity and improve setting factors for families.
To address resource education, specific interventions focused on decreasing access barriers, decreasing attrition, and promoting positive change within families. The interventions also address setting factors like transportation, childcare, low-cost services, and offering home-based sessions to decrease dropout rates among families.
Durkin and colleagues developed a community advisory board of ASD professionals to improve case management. This intervention would increase transparency among families and promote interprofessional care within the treatment process.
Social support optimization can be increased through a professional social support intervention and utilizing Compass for Hope therapies for parents. The first suggested bolstering support among parents by enhancing their relationship with service providers. The second intervention empowers parents with knowledge of their child's maladaptive behaviors to improve parent management of these behaviors and reduce parent stress.
Each of these interventions, whether they focus on resource education, case management, or social support optimization, all act as possible future approaches that professionals can take. By utilizing these approaches, interprofessional care providers can begin to address resource scarcity and improve access to services among low SES families who have a child with ASD.
Thank you for taking the time today to listen to our presentation.